Good afternoon and welcome to today's webinar, Collaborative Care Solutions, Smart Strategies for Fall Risk Assessment, Detection, and Mitigation. Our speakers today will be Colleen Tobey and Tiffany Robinson, and I will do a couple housekeeping items for the webinar today, and just want to point out, if you do have a question throughout the webinar, if you put it in the Q&A, we'll get to as many of those as we can immediately at the end of the webinar. And if there's any we can't get to, we will send those questions out, the answers and questions out at a later time. You do need to attend the entire webinar in order to receive credit. There will be an evaluation sent out along with the handouts at the end of the webinar via Constant Contact. So watch your email for the link to the evaluation, as well as check your junk folder if you do not see it. You do need to attend the entire webinar to be eligible for that credit. I want to thank everyone for attending, and Colleen.
Well, welcome everyone, and thank you so much for attending today. My name is Colleen Tobey. I am the Vice President of Clinical Services for Pathway Health, and I've got a co-speaker, Tiffany Robinson. Tiffany?
Hello, my name is Tiffany Robinson. I'm honored to be here with you today. I've worked for ComForCare for the past 19 years. I hold a bachelor's degree in social work from Oakland University, located in Rochester Hills, Michigan, and a certificate in instructional design from the University of Maryland. At ComForCare, I work as a training specialist. I specifically work with onboarding our new offices and helping them facilitate their training programs.
Well, thank you, Tiffany. So we're going to go ahead and start this session. As you were instructed, please hold your questions till the end of the presentation. We'll have about between 5 and 7 minutes left to answer some of those questions. So the first thing I want to do and share with you today is our learning session objectives. As we know, upon completion of this session, participants should be able to assess the fall risk for those living in the community. We're going to discuss age-related changes and environmental risk factors, and then identify a comprehensive multifactorial approach to fall prevention. We know that as you age, you become there's a higher risk of falls, and of course, anytime an individual falls, there is a possibility of an adverse event. I want to give you some statistics, and as you can see here, you can see they have broken this down by the age of male or female, and then of course by race and ethnicity. As you are well aware, there is a high level of, after 85 years plus, about 34% of those individuals have fallen or will fall, and more females than males. But the alarming statistics is, I want to bring this forward, is that fall-related deaths in the United States. So this is not a problem that only a few people have to look and analyze. This is throughout our community. Within this, falls are the leading cause of injury for adults over the age of 65 and over. It's estimated that 14 million, or 1 in 4 older adults, report falling every year. And this chart really shows as a very good indicator of the number of deaths per year. They've done some provisional statistics for 2023 and 2024, but you can see the falls related to deaths increased in 2021 and 2022. So we've seen a little bit of a decline, but still it's an alarming rate that we end up falling. 1 out of every 10 falls result in an injury to that older adult, and it may restrict their activities for a day or more, or they have to seek attention into the healthcare system. It's estimated also in the United States, there's about 3 million emergency department visits due to older individuals falling. And then every year, at least 1 million fall-related hospitalizations among older adults. Research has documented this very clearly, and they've noted with these falls, 83% of the hip fractures result in deaths, and 88% of the emergency room visits and hospitalizations related to fractures are recorded every year. 319,000 older adults are hospitalized for that hip fracture. And with the older adult, there's another risk factor, and they're falls are the most common cause of traumatic brain injuries in those older adults. Well, a lot of people may fall in the community and they may not even report it, or they might not tell their practitioner, or they maybe not tell their family. But falls will lead to broken bones. They'll lead to very serious injuries, especially if an individual is taking medications. And medications is one of those risk factors. So think of that older adult that may be taking medications like blood thinners. Those individuals that fall should be seen right away, because they could end up with some type of brain injury. Even if they're on some type of blood thinner and they fall and cut themselves, that's also a potential result of hospitalization. And then we know that often falls result in a nursing home admission. And if we look at our ability as healthcare providers to take a serious look at what we've got going on in our community, we may provide an element to maintain our individuals and our older adults in their homes longer. Our goal throughout the course of this in-service is really to look at the risk factors, how people age differently and have risk factors within different living situations. When you think about normal aging, I guess we're always very happy that, yes, I'm getting older. I had another birthday and I feel really good. But there are some effects related to aging, and virtually all organ systems are having physiological changes associated with aging. There is definitely a loss of cell turnover. We know that we have a little bit of skin wrinkling. There's a decrease in skeletal mass wasting. Atherosclerosis, there's a decrease in vascular compliance, there's cerebral atrophy. All of these are things that we see within aging population. Think about gastrointestinal. I'm going to take that that one system. And with this, they have, as you age, you have a decreased loss in smell and taste. With that, you may have a decrease in that ability to have good food intake, or there's a weakening of the smooth muscles in the intestinal tract that promote the development of diverticulitis. And that may play a role in bowel obstruction and constipation along with medications. When people become ill, they're more at risk of falling. Then our renal system does have an increased prevalence of sclerotic changes. And within that, there is a decrease in the filtration rate observed in the advanced age. We have medications that attribute to that. And we can end up developing chronic or acute kidney disease. And if you think about the population in the community and the number of dialysis centers we have right now, we've seen an increase over the past 20 years. Cardiovascular, I mentioned, a lot of problems happen with our cardiovascular disease development, our vascular stiffening, our increased left ventricular wall thickness, and of course, that decreased aerobic tolerance and increased problematic cardiovascular diseases. Well, respiratory systems, they have difficulty in decreased chest wall compliance. Being sedentary and sitting all the time definitely will lead to an increased work of breathing, and additional decrease in strength reduces that ability for respiratory muscles to function correctly. Endocrine changes, age-related. Oftentimes we see people that have metabolic and hormonal changes, things such as our hypothyroid diseases, diabetes, and of course, impaired ability for women experiencing menopause. And with that menopause that occurs usually in the 6th decade of life, it also has an impact on our bone strength. Vision, I Vision is extremely important as we age, and understanding that decreased visual acuity and binocular types of functions within that eye, we have a decreased dark adaptation, delayed glare recovery, and changes in our color and our vision. And this is normal. This is normal aging. So it's not like we're going to be able to say, I'm going to beat this. If you live long enough, you are going to experience some of these problems. But there are changes in both the quality and the physical location within the eyes. And if you have dementia or any other type of disease such as that, the visual changes are going to be markedly worse. This is something we need to look at right now, and you want to make sure that as individuals age, you have to have and understand that loss and gradual loss of muscle mass and muscle strength. This condition commonly affects the elderly population, and it does occur during aging. So after the age of 30, we are going to start losing about 3 to 5% of muscle mass each decade, and inactive people lose the most. So if you're thinking about this as you're working from home, you might say, I need to get up and move a little bit more, because after the age of 80, studies suggest between 11 and 50% of the people have sarcopenia, which means that loss of muscle mass. It is quite common, and that loss of muscle mass is very common. And as you age, there's certain changes that play major risk factors, including the amount of protein that you're taking in, the ability to ambulate. There are some low concentrations related to that insulin-like growth factor, their decreased ability to turn protein into energy, and then we have an increased inflammation, partly due to disease processes, and again, partly due to aging. I mentioned the decreased and conditions that have risk factors, and eye and vision is one of them. Other things that we'll discuss are that vitamin D deficiency. And think about the older adults that you might be caring for in your assisted living or in home care. Are they routinely having their vitamin D levels checked? Are you assessing them for difficulties with walking and balance? And then, of course, that use of medications. And if you count the number of medications that the individuals and the older adult are using, there is oftentimes medications that do affect the balance. And they estimate about 200 different medications affect balance. Visual problems, foot pain, poor footwear, and then, of course, home hazards. Within this, as healthcare providers, you can help cut down that person's risk by reducing all of those risk factors that I just listed. That vision, making sure they had their eyes checked, those home hazards, and then assessing that difficulty with balance and ambulation. Well, balance correlates with hearing, and hearing loss affects about 36 million people in the United States and becomes more common with age. 1 in 3 Americans between the age of 65 and 74 have hearing loss. So if you're over the age of 65, you might be experiencing a little bit of hearing loss. That's 1 in 3, but by the age of 75, it's 1 in 2. Now, hearing equates to balance, and problems with the ears, whether they're hearing or balance, can both affect the way you function. It also affects your self-confidence. In addition to this, if you have trouble hearing, you might feel very uncomfortable with social situations and very frustrated because you're not able to hear. With that you withdraw from other people, then you would do less ambulation, less being out in the community, and of course, higher risk for falls. So as it turns out, you have to understand that as we age, it's kind of like walking a tightrope. Your body uses these 3-part systems to keep you upright. And when one of them fails, you're more at risk for falls. So that vestibular organs in your inner ears, it's kind of like our body's GPS. And that helps with balance. It helps us stay upright. It's important. It's very important. So think about this. Within our adult population, after you're over 40, You may experience some wobbliness, and it's estimated that about 35% of individuals over the age of 40 experience some balance issues. Then we have our eyes. Don't forget your eyes. Make sure you're not stepping into the abyss. Poor vision, lack of assessments related to their eyes may put you at risk for falls. And then we have sensation. And this is a kind of a proprioceptive sensation. It's just kind of a fancy term to know where your feet are without looking down. Now, if any of you live in a colder climate and there was ice, any areas during this winter or even in the spring, we know that we sort of look down to make sure we're not going to be slipping on ice. But within this, your vision will help you create that balance. And we have to be able to understand that vision plays a huge part in fall prevention. I mentioned hearing. There's diseases such as Meniere's disease. There are medications over the counter, things as simple as aspirin that can cause some hearing loss. And then anything for cardiovascular, things such as ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. So as I stated, there's approximately 200 different medications that can affect your balance. So with balance disorders, it's that feeling of spinning. And within this, you may feel like falling or staggering, lightheadedness. Lightheadedness becomes a problem usually related to your visual deficits. But make sure that when you're caring for that older adult and they are going to the clinic, that they fill out a clinic checklist and make sure they are able to state, "Doctor, I'm having a problem with balance," or "I feel dizzy." If there's other medications that they may be able to use other than the ones that may cause dizziness, the physician should address that. Inner ear problems, well, certain infections cause inner ear problems, causing vertigo and plain imbalance. And then substance use disorder with the older adult, and I'm going to take that as alcohol, can cause balance and dizziness problems, and it affects the inner ears. Other medical conditions such as thyroid or blood vessel disease. Always take a look at these balance problems, and if you have some of these symptoms as you're doing their community assessment, ask them about vertigo. Do they feel like they're going to fall? Are they staggering? How do you maintain any lightheadedness when you stand up? Are you having any blurred vision? And again, loss of hearing may cause some disorientation. If you think your client has some vision problems or balance problems, make sure it's addressed, because it can be very simple, like a change in medication, getting new glasses, making sure their hearing aids fit, making sure that they are addressing their any types of nausea or vomiting or underlying comorbidities. But medications, they're definitely a risk factor. Check for those psychoactive medications, and individuals in the community, in assisted living, and in long-term care are using these types of medications or psychoactive medications. Even some herbal supplements can be attributed to falls. Some of them do actually cause some confusion and blurred vision. If you go into any type of TV program, or there's a lot of information that is being provided during those wonderful commercial breaks about if you use this medication, your memory will get better. If you use this medication, you'll have less pain. But any medication that you put in your body has potential for side effects. So when you're caring for those clients in the community, make sure that medications are at the lowest possible doses. If they are being treated for depression or anxiety, identify the risk of increased falls and make sure that they're taking that medication at the right time and at the right dose. Medicines also to treat seizures, such as analeptics, also attribute to that fall risk, and they have a very sedative side effect. Then back pain, and individuals with back pain may or may not, but often they're using some type of muscle relaxant. And that, again, combined with other medications such as blood pressure medications, poses a risk. NSAIDs, your ibuprofen, your opioids, those medications will cause some sedation and dizziness and then trouble thinking. So if you've got a visual problem and you can't hear very well and you're taking medications that make you dizzy, you are more prone to falls. Well, there is some factors I want to discuss, and we're going to talk to you about intrinsic and extrinsic factors. Our intrinsic factors are, of course, our advanced age and poor vision and chronic conditions. Individuals that fall once are fear of falling. And I'm going to give you a little example. It rained in where I live, and of course it froze. And I walked outside one morning to take my dogs out, and I fell flat on my back on my deck. I was a little bit fearful of falling. So now when I open the door, I gently put my foot out and rub on the deck and think, oh, it's not icy. So think about that older adult with that advanced age and their fear of falling. Even people that have incontinence and having to get up at night, definitely some problems and intrinsic risk factors. Then we have our extrinsic risk factors, and that's taking a look at that home. There are homes that have very dim lighting or they've got glare. There are slippery, uneven surfaces, especially when they exit their house. Psychoactive medications, the lack of bathroom grab bars, and the lack of handrails in their stairs. There again is obstacles and tripping hazards in their home, but research has identified through a good community-based assessment, both with intrinsic and extrinsic risk factors, you can reduce falls within the community. Now, this is really a community type of program, and I want to show you what you have an opportunity to use some of these tools. When we're working with that older adult living in our community or in our assisted living, we've got to take a look at some very basic elements. One, we've got to screen patients for the risk of falls and then do a root cause analysis. What are some modifiable risk factors? My age is not modifiable. Maybe I need new glasses or some hearing aids, but we've got to take a look at those intrinsic and extrinsic modifiable risk factors. And this STEADY program that is identified by the CDC is really an older adult fall prevention program. Then, of course, they've got strategies that we can have our communities start looking at. There are effective both clinical and community strategies. So what can we do within our community to help reduce falls? With our STEADY algorithm, it's a fall screening and assessment among community dwellers 65 years or older. This can be applicable not only to your individuals living in their own homes, but again, in your assisted living or your older adult communities, even independent living with some services. But there are very specific things. And the goal is we need to screen. Are we checking them for their vitamin D levels? Have we referred our older adult to a community exercise or fall prevention program? What are we doing as far as assessments? And there are specific assessments such as the time up and go or the 30-second chair stand or the 4-stage balance test. Looking at all those assessments and screening and then developing interventions to keep our older adult in their home. Now, when I spoke of home, I know that if you have been working in the community and going in as a home care nurse, a home care aide, working in assisted living, not all homes are like what we would want our homes to look like. So sometimes there's a little clutter. So if you're going in and assessing, one of the areas is to go room by room and look at the risk factors. I've even found boxes stacked on the stove. So I'm guessing they're not doing a lot of cooking, but there's been boxes there, and that's a risk factor. As we look here, make sure if you've got room by room, what are some of the things here? Are there good handrails? Can they easily move around the furniture? Are there areas to walk that are tidy? And Sometimes I go into homes where there's a lot of boxes stacked all over. Are they walking on a very uneven floor, or are there carpets that are not firmly affixed? And of course, making sure that we can illuminate and they've got good lighting. Then we've got our bathroom. If you just look at this bathroom and look at all the things that could possibly happen here, they could trip on the scale, they could slide on towels or things on the floor. There's no grab bars, but making sure that they're inserting rails, they are looking at light controls, even using, and right now we have the technology to do this, motion and voice activated electronics. We want to think about some of those elements that we can put in place to prevent falls. And then there is a home safety checklist, and the CDC has this available. It's a check for home safety fall prevention for older adults. So if you want to develop a program, or you're thinking of starting a program in your community, your assisted living, your independent living, even nursing homes, take a look and do a safety checklist. And what do they have if they're being discharged home? This is another great type of checklist. We also have to take a look at some other risk factors related to their heating blankets and making sure that they are able to reach their medications that are stored. Well, we also have to identify what happens when they leave the home. Is there adequate lighting? Is there a ramp installed if they need, along with handrails? And what is that walkway if they are living in an older adult apartment or an apartment? What is the walkway to that home entry? And then making sure that we don't have doors that are so heavy. So you'd want a lightweight door and screen front door, and making sure that the knobs can turn. So think about those elements. My favorite, footwear. Well, we all like, as a young adult, I used to wear wonderful little heels, and I thought they were so pretty, but they are not very safe. So look at those older adult shoes and have that podiatrist check the feet to make sure that you have the correct footwear. Podiatrists will diagnose and treat foot conditions. In addition to that, when I talked about that leading cause of falls in the older adults, having inappropriate footwear, as I stated on that right hand of this slide, is a risk for falls. We also have some changes in our structure of our foot, which includes that reduced flexibility of that ankle joint and reduced muscle calf strength. There also is that muscle that helps you rise to the balls of your feet. There's a reduction of sensation. So it's not just one thing. You could end up with bunions or toe deformities, but make sure, and I always stress this, please make sure that you avoid walking with socks inside and outside the house. Make sure that you have good footwear and get your feet measured and use the correct footwear. Well, last but not least, prevention of falls when the older adult is exercise and strengthening. These exercise programs are so very important. There's an example, of course, within that chair rise exercise program that is part of the STEADY program on the CDC website. But it talks about just doing that sit to stand, that ability to go ahead and lean forward in a sturdy chair, knees bent, and resting your hands lightly on the seat and pushing yourself up straight forward. There are many exercise programs that you may want to use in your older adult facility. And these exercise programs are to be, one, fun, not necessarily work, but also engage them and make them feel part of that community. Simple things such as walking or chair exercises or chair arm raises, strengthening, water aerobics, and even Tai Chi. I want you to take an opportunity, and if you haven't, is to look and analyze Tai Chi. Tai Chi is a program that we are using and seeing more use in our older adult facilities that provides that balance and strengthening. It's a movement. And there is documentation that indicates the use of Tai Chi in the older adult population reduces falls. And the data definitely identifies that this one exercise program, along with balance exercises, is very effective. So take some time and just look at that. And if you want some additional information, put it in the question box or chat box and I'll send it out to you. But even going online and looking at an exercise program that you can even purchase, maybe a tape that you can use in your facility, but understanding Tai Chi. I've seen some very effective fall reduction programs related to that exercise program. Water aerobics are great, strengthening is great, chair exercises, and of course, we can never forget walking. And then balance exercises. And anyone over 40 should be doing these right now. So go back in and look at balance exercises and see what you're doing and how good your balance is. Well, with pharmacy and fall reduction, medication is a huge indicator of whether or not an older adult is going to fall. And about 30% of the medication class uses 30% of the medication, and individuals use one psychoactive medication. They were assessing the adult population and trying to screen them for every type of pharmacy risk. Now, within the program and within that study program, there's a guide for pharmacists. And I want to talk a little bit about that interdisciplinary team. We often hear about it at hospitals or nursing homes or post-acute care facilities and LTACs, but the community-based services should also involve that pharmacist. Pharmacists can help, and they'll take a look. And if we look at all the older adults, there's estimating about 9% of the medication classes use 3 or more psychoactive medication. And that's going to cause problems. And orthostatic hypotension is one of them, along with they're not eating very well. They probably are taking medications that cause confusion, even sleeplessness. So here is that fall prevention that the pharmacist plays a huge role in. They'll look at all these medications, and this is a community guide for pharmacists. You want to maybe engage your pharmacist. If you're in an assisted living and you've got a consultant pharmacist, this could be one of the programs that you might want to initiate. But pharmacists also use a geriatric support tools such as the American Geriatric Society or the Beers criteria, even screening tools for those older adults and those prescriptions. You identify the possibly inappropriate medications, and they're looking at falls, fall screening, and then of course, taking 4 or more chronic medications and taking at least one high-risk medication. That is that ability to assess that older adult. Also within this, they are going to go ahead and evaluate their strength and gait and balance. You don't have to have everyone on a therapy program to do some very, very good exercise programs. When we look at your risk factors, and again, we've got to have some conversations with that older adult, and we've got to talk about aging. And it's very difficult for individuals to talk about aging. Many adults and caregivers may feel that they have a false belief that falls are a normal part of aging. And I heard that once, that's their right to fall. No, no, no. You don't want your older adult to fall. By looking at these risk factors and steps to ensure the older adults living in our communities remain safe. If we decrease falls in our community, we're going to improve the quality of care, the quality of life, reduce rehospitalizations or hospitalizations, and then possibly even avoid long-term nursing home care. So just make sure this is a wonderful checklist that's available. It is based out of the VA Geriatric Research and Education Center, and those references are listed at the end of this presentation. But look for risk factors, and then making sure our community is safe. We want to encourage the older adult also to speak up and understand what they're going to talk to their healthcare professionals about. making sure that we keep on moving and that we have yearly vision exams and we have those podiatrist assessments of our footwear, and then looking at the fall screening. And this is that provider. Again, using the provider. So think of your IDT team outside of that nursing home. So you have got that care coordination with your home care agency. You have got that ability to discuss this with your pharmacist and your physician and of course the nurse. So you want to make sure that we have good screening assessments, coordination of care, and communication of these risk factors. Providing this background will provide that ability to educate not only our older adult, but even family members. And make sure that you empower your patients so they understand that need to ask the very important question. So with that, think of the actions and think of some of the things that you want to assess for, looking at all those systems, the overall changes in your body systems as we age. And then Tiffany is going to talk about the strategies to educate caregivers. So Tiffany?
Thank you. Let's talk about the education of your staff and ways to implement a training program. Next slide, please. Educational needs of the nursing staff. Our number one goal when it comes to training is enhancing our professional staff skills. While improving the quality of care for clients, we want to promote staff and client safety. We want to comply with regulations and attract and maintain quality staff members. Why does having a comprehensive training plan matter? Training provides employees with the skills they need to provide quality professional care. Employees who receive regular training are more likely to feel supported and engaged in their roles. They are also more likely to be more satisfied and comfortable with their position. Training plays a vital role in the home care industry, and it's not just meeting the requirements. It makes sure that employees are well equipped to provide top quality care. It helps employees feel supported and engaged in their roles. This can actually help reduce staff burnout and turnover. Training can encourage career development and advancement opportunities for employees. Added training and education can encourage a higher level of interest in learning, and an interest in learning can then lead to a career advancement. For example, having a caregiver pursue a nursing job. Training can aid in stress relief and management. Employees who feel well prepared and supported are really just going to have lower levels of stress. Training is also going to lead to improved satisfaction of clients as they are receiving consistent quality care. The more knowledge, skills, experience your employees have, the higher likelihood for their productivity and effectiveness in the care that they provide. The first part of thinking about a training program and a training plan is to think about not only providing initial training to new hires, but also to provide ongoing training on at least an annual basis. It is always important to touch back on important topics, provide re-education as needed, especially as we touch on today's topic of fall risk. We want to make sure we provide the valuable training and support to our staff so they feel comfortable and confident providing care, especially as we're working in an environment where the client's needs and condition can change quickly. As you create your training plan, make sure you have clear goals. The first of these is to make sure we include all compliance requirements. Of course, looking at state and federal level, as well as CDC guidelines and any other guidelines that you may be required to follow in your organization. On top of hitting all of the required content, you also have to consider what content you may want to include that's not required, but it would really add to the goals of your training program. Adding in additional training can greatly help, especially when we think of a topic like fall risk. They need to have a plan, they need to have tools, and they need to have interventions to have a higher level of success. You also want to communicate your training plan to your team and staff and make sure that you encourage communication and questions to be brought to your training lead. Regularly look at your training plan and adjust, add, remove items as needed to ensure you are constantly hitting the goal of the training you're looking to provide. Do not be afraid to ask for employee feedback, as this is how you can adjust and readjust your training curriculum to fully meet the needs of your staff. Ask them, what items are we missing? Are there topics we're spending too much time on? Is the information presented in a digestible format? Feedback is key to building a program that is meaningful and successful. We want to make sure we are proactive in our training planning. We do not want to constantly be reacting to situations. We want to try to anticipate the tools and interventions that the team will need. I encourage you to always take a proactive approach to training. It's much easier to provide training ahead of time versus responding to an issue and feeling as though you've very quickly and very reactively are adding new training due to a missing link in your previous training. Let's talk about ongoing surveillance. Many of us are already checking in for reassessments, periodic supervisory visits. Make sure you're taking advantage of seeing your professional staff members in action. Are they following protocols? If not, use this as a teachable moment and provide on-the-spot training. Coach your team by example. Show them proper techniques if needed. Keeping the lines of communication open, encouraging them to reach out with concerns, be available and respond promptly to staff training questions and concerns. Keeping those lines of communication open when we are working with a client who has already fallen in the past, as we know those who have had previous falls are now more at risk for future falls. Next slide, please. Let's now discuss training implementation. The biggest part of a training program should be that the program is tailored to the needs of the staff and their clients. Different training methods you might utilize are instructor-led. So this is in-person training. Think of our traditional in-person training. E-learning. Do not be afraid of venturing into the virtual world. E-learning can have huge benefits for your team. It allows training to be provided at the caregiver's fingertips, and it can be available to them 24 hours a day. You also add benefits such as gamification to your training, which adds small gaming elements to your training, which can encourage engagement and motivate employees with friendly competition. Blended learning. This takes the in-person training and the virtual training and puts them together, presenting some topics in person while allowing other topics to be covered in a virtual element. Coaching. This allows a more personalized approach to training with a one-on-one focus. Role playing. This allows your team to practice skills on one another in a low-stress environment. Job shadowing. This allows your team to see a more skilled or experienced staff member perform the skills and learn from seeing the skills performed in person. These are only some of the many methods that you can use in your training. I recommend that you try different methods and challenge yourself to find the best fit for your team. How do you maintain training success for the long term? Train your trainers. Training is always evolving, and trainers must be lifelong learners. We need to stay on top of new findings and methods. What is new in the industry? Take time as a trainer to attend conferences, stay on top of studies and new findings. Tips for leader success. Again, be a lifelong learner. Have a commitment to development and improvement. Be open to learning. Sometimes as a person who's been in a role or an industry for many years, we feel as though we know it all. We have to be open to what we don't know yet. Be adaptable. If one method isn't working, try something else. Be open to different learning styles and methods. We have to be open to new ideas. We also have to be open to technology as it evolves and offers us new solutions for training. You also want to make sure when you're creating a plan, you are respecting your audience. I love training as much as the next trainer, but we cannot disrespect our audience by giving them too much training or not respecting their time. What is the right amount? What are we required to provide? And then what is the amount that clearly provides the information in a digestible way? We also have to look at the needs of our audience and their challenges. If you have staff members struggling with the way you are providing training, consider offering a separate training session for those that are struggling. Do they need a job shadowing session? Do they need some coaching through a particular skill? Be an effective communicator. Use clear language to build rapport with your team. You want to encourage continuous learning. Express excitement when your team finishes training. Consider offering a small token of appreciation when training is completed on time or if optional training is completed. And finally, don't be afraid to repeat training. Sometimes we need to see the content annually, and reminders on skills can always be helpful. Next slide, please. In the example I want to share today, we are looking at a home care agency providing supplemental staffing for an assisted living facility. As many assisted living facilities, many of the residents are individuals who are regarded as a fall risk. The community wanted to make sure that each and every caregiver entering the building had training on fall risk management. To meet this need, we looked into our library of courses on our learning management system, and we found a well-rounded curriculum of courses to help each caregiver have a basic knowledge walking into the community to provide care. This included courses on utilizing home safety checklist that was customized to this particular facility, looking at environmental risks such as poor lighting and other hazards such as non-essential furniture, coursework on how some medications can leave clients with nausea or lightheadedness and how to watch for signs of a fall risk. This training was provided virtually at the caregiver's pace, requiring that coursework be completed prior to working in the facility. In addition to the online coursework, we also had our nurse manager provide pop-in visits to ensure caregivers were provided adequate care and caregivers felt comfortable in the care they were providing. If a caregiver had questions or needed guidance, we would provide them with on-the-job support by having our nurse manager or lead caregiver show them proper techniques and skills, and then having them show those skills learned back in a teach-back method. We also regularly asked our caregivers, clients, family members, as well as the building management for feedback. We also realized that this particular facility had recently gone through some budget cuts. One of the items to be cut was exercise programs. We found value in providing an exercise program on site with our staff. We utilize exercises such as the CDC recommended chair rises as a simple way to help our residents gain strength. We also put together workshops for the clients and family members to attend, which highlighted fall risk and ways to promote their loved ones' independence by just having smarter practices in their apartments. For example, we touched on footwear, use of assistive devices, and hazards in their residences. Our goal was to have family and client buy-in for easy recommendations to lower fall risk. This office has now had a 3+ year relationship with this assisted living and really credits their commitment to training as well as the addition of their exercise program for this ongoing relationship. As always, screen the client, assess the needs, intervene with training and support as needed. Colleen, I'm going to pass the group back to you.
Well, thank you very much, Tiffany. That was really informative, and she's got some very good life experiences related to putting programs in our home care agency that serves an assisted living. So thank you very much. Excellent information. Along with that, we've got about a little less than 10 minutes, but we've got that time and opportunity to go ahead and you can ask some questions. So are there any questions?
Colleen and Tiffany, we do have a couple of questions in the chat. What is the #1 risk factor for falls? What are the sources senior get training?
So I'll answer the number one risk factor to falls. And Tiffany, would you mind addressing the training? Okay, so I'm hoping I understand that the number one risk factor for falls is just plain aging. It is a huge risk factor after the age of 65. Of course, this is individualized. It's based on your comorbidities, your medications, your previous lifestyle, diet, exercise, but age is number one risk factor for falls. And could you address the training, Tiffany?
Absolutely. Helping your staff stay on top of the latest practices, what they should be doing, is really by creating a culture of continuous learning. We want to make sure that we are constantly training, and that's something that we're doing. One thing that we've done with our staff is we've had lunch and learns, so we can share new things that are coming. We can share ideas with one another, and it's really a great time to be able to share insights and emerging trends that we're seeing.
Thank you. Tekla?
There's another one. Any footwear recommendations for arthritic feet that swell as the day goes on? Foot pain from arthritis. And I'm not sure. So largest shoe size is worn and often backless.
Okay, well, a couple things that happened. They've got some very good footwear out there if I want to compare the last 20 years. They even have those shoes that you can just slip on, you don't have to bend over. Great for people that have just had hip surgery. But yeah, you should go to a podiatrist or a specialized shoe store and get good footwear. Making sure that they take into effect swelling. They'll take into effect how long you're walking. They'll make sure that they'll do that measuring, because remember, as we age, the fat pads on our feet shrink. So it's different. So they're gonna have to have a good base for footwear. Sometimes they might have to even wear inserts. And there's diabetic shoes for people that have the neuropathy. There's special socks, but yes, they should go to a specialized footwear and then talk to that podiatrist.
There's another question. How do you get buy-in with stubborn seniors living alone who are not realistic about obvious risk factors, living in a multi-story home with stairs?
Tiffany, do you want to tackle that? I have one of
Sure
those
thing.
I'm dealing with right now. I think he made 9.
So for us, one of the big things that we do is not only are we trying to get buy-in from the client, the patient themselves, but also the family. When we're getting buy-in from multiple individuals and also our staff, right? So the more people that are buying in, the easier it's going to be to implement some of these items. It's also hard when you've worn certain shoes your entire life and you don't want to wear different shoes now, or you've had this beautiful rug in your bathroom, but guess what? It's a fall wrist. There's no gripper on the bottom of it. It can be very hard for our clients to accept that maybe some changes need to take place. What we've done with some of our clients where we find that there's quite a bit of resistance is we will utilize, if we have a social worker on staff, have that person go in and work with the family and the client in identifying the fact that yes, we're making some changes, but these changes are going to allow you to be independent. You want to stay in your home, this particular person, they want to be in their home that they've probably been in for a number of years, maybe 50, 60 years. We want them to stay in that home. And so helping them to slowly see that some of these recommendations are really us being on the same team. We want them to stay in their home, and that's how we do it.
And one thing I'd like to add, there's a lot of adapt equipment out there right now. I mean, even chair lifts that are put in the home to have them go up and down stairs, and it decreases that risk of falling. So go ahead, next question.
Do you provide training in person in San Diego? I'll print this out and we'll look up your contact information. Somebody will be in touch with you. Are there Tai Chi apps to download?
There are, and you'll just have to go online. I use the CDC website, and then I kind of went through that and found Tai Chi. There are videos out there that sometimes I've seen used in post-acute care, that they have developed exercise programs for a certain population it would be very effective. So you can get videos. There are people in the communities too that will come in and teach Tai Chi for the older adult. So they will do that in a community. I don't know, Tiffany, do you have that type of program in any of your buildings?
Yeah,
you
so
work-
sometimes what we've even done as a way to be able to provide, an exercise program to more than one location is we've actually at times had a person that would be able to, let's use the Tai Chi, have that person that can run us through a general workout session, and we're utilizing technology. We're putting that on the wall, and you have a person that's in there maybe from your staff that's kind of helping, making sure that people are able to see what's going on. But that's a way that we've been able to do that. We've done that with exercise programs. We've done that with sing-alongs. We've done it with so many things. And it's just a great way to lean into technology when we don't necessarily, if we don't have someone to send to each of those locations, it's a way for us to do it, for the masses at one time. And we've definitely done that.
Okay. Do you have a root cause analysis for post-fall decisions? Probably a tool or a form. The same person had two.
We can get back to you on that. And yes, there are some ideas for root cause analysis. The CDC, I will tell you, the STEADY program is just full of information. So I can send that link out to you, or we'll be able, Tiffany, you probably have an idea too, what they can use as far as root cause analysis. So
Will you be providing exercise examples in the email?
I can provide links. We can provide links to exercise examples that we have sourced not only at the end of the slide, but also in the content of some of the information.
You spoke about the importance of checking vitamin D levels. How often do you recommend this be evaluated?
That's a very, very good question. And I've talked to physicians. Typically, physicians do it yearly, but I'm going to tell you that some do it more frequently. And a lot of times it depends on their insurance carrier. Honestly, because sometimes insurance carriers will not pay for it at a certain increment. But I know that testing vitamin D levels is not very common. It's not a common test that you'll do, but I'm seeing more and more physicians that care for that population do check their vitamin D level. So
Is there in-service available we can utilize to train our CNAs on fall prevention? We can answer that offline if
yeah,
we will be sending out the answers to questions and expanding on some of these that we don't have time to completely cover as well.
I think Tiffany did an excellent job on the importance of using different training strategies. So it's not like one size fits all. We'd like it to be that way, but it just isn't. So she gave some very excellent examples of different techniques to train your staff. So
Do you have a resource you can recommend that has intervention examples for falls? We can answer that.
offline, yeah.
I'm actively seeking a live caregiver training. We can get back to you on that as well. Looks like we've got names associated. What are your thoughts on menu planning? We can probably answer that offline as well. Let's see. Any ideas to help decrease falls in resident living with dementia in a memory care unit who can't remember education?
I'm gonna go ahead and answer that. I'm gonna tell you that every person, we talk about dementia, remember every type of dementia, that disease process affects the brain a little bit different. So there's different types of the brain areas that are affected by Lewy bodies. There's different types that are affected by Alzheimer's. One of the things that happens, I think, in dementia is we do not understand their overall visual deficit and their hearing deficit. So we're assuming that they can have a good peripheral vision when they can't. We assume that as their visual perception narrows into something like this, we have got to make that, first of all, our staff very aware that a lot of times that balanced vision and hearing are going to result in a fall, poor balanced vision and hearing. So you've got to look at it on not just one specific intervention. You've got to look at it as a system and then understand that as we progress with different types of dementia, our brain's affected. And I will tell you that balance is one of the things that goes first. So balance exercises do help.
Okay, there's another question here about those with Parkinson's and dementia and those that are ambulatory. What about those? And probably the same.
Yes, basically, the thing is, of course, is to do a good assessment, see where they are, having your occupational therapist take a look at and physical therapist take a look at their ability for balance, their fall risk, all the medications, vision, hearing, history of falls. It's a multi-system assessment.
Oh, okay. We are over our time, so I do see a few more questions in the Q&A. We will answer those offline. Looks like Lori Keppel also shared a link to a Wisconsin resource that we will send out to participants.
Yes, thank you, Lori.
All right. Well, thank everyone for attending today.
Thank you. Have a great weekend.